Much has been written and reported about the Ebola epidemic that has been devastating three of our sister African nations, Liberia, Guinea, and Sierra Leone, and posing a tremendous health threat to the other nations in the West African sub-region and beyond. The facts and figures of this disease are all too familiar for those of us in attendance here today. The World Health Organization has reported an estimated total of 13,567 confirmed, probable, and suspected cases of Ebola from 6 affected countries: Liberia, Guinea, Sierra Leone, Mali, Spain, and United States of America, as well as 2 previously affected countries, Nigeria and Senegal. A total of 4,951 deaths have been reported. But today I would like us to move past a perfunctory discussion of facts and figures. Today I would like for us to look past the data and see the faces of those affected by this disease. I would like for us in our deliberations on how best to assess these nations as they grapple with this immediate crisis, to talk about Ebola not simply from the head, but also from our hearts. When we speak of 13,567 reported cases of Ebola, we speak of 13,567 human lives. We speak also of the countless other lives that are joined to those individuals in their families and in their communities. We speak of the countless other people who may also come in contact with those 13,567 individuals. These are healthcare workers, teachers, friends, complete strangers, people in schools, churches, mosques, and other places of worship, or on airplanes and buses, at the market, at funerals, at weddings. We are all, each and every one of us, sometimes unknown to us, affected by this deadly virus. So we gather here today, each and every one of us, not just as heads of state or representatives of our nations and organizations, but as human beings heeding the urgent call for help that has been issued by other human beings. This is not the first time such a call has been issued as the result of a dangerous and fast-spreading epidemic, nor, unfortunately, will it be the last. Such a call was issued in 1918 when the world came together to fight the influenza pandemic. The virus affected 500 million people and claimed the lives of at least between 50 to 100 million. That was roughly 3 to 5% of the world population at that time. Investigations have suggested that influenza pandemic began in France, but the spread of the virus was so swift, covering the entire globe, stretching from Australia to the Arctic, that ultimately its origin became of very little importance. When it comes to the occurrence of an epidemic, every nation is vulnerable, now more than ever before. With the advancements in travel and technology, people are more mobile and our borders are more fluid. With this fluidity comes tremendous rewards as well as unforeseen risks. With this newfound ease of mobility that allows us to traverse continents for the purposes of trade and tourism comes a responsibility that requires us, if only for the sakes of ourselves and the well-being of our own people, to make available whatever resources are necessary to bring an end to this current epidemic as quickly as possible. In September, when I addressed the United Nations General Assembly, I offered a description of the Ebola virus and the crippling effects the outbreak has had. I have since then offered the same description in other addresses I have given, because I feel it is the most authentic description I can give, and as such, I believe it bears repeating. And in quotation marks, I said, what makes Ebola so dangerous is that the virus dares us to compromise the impulses that exist at the very core of our humanity. Our impulse to comfort one another with love, to care for each other with the healing power of our touch, and to maintain the dignity of our loved ones, even in death, with a public funeral and a properly marked grave. Ebola is a disease of isolation. It leaves family members afraid to embrace one another. It leaves health workers afraid to attend to their patients, and it forces the living to abandon the cultural rites of washing, embalming, and burying their dead. Instead, we zip them into a secure body bag, carried on a stretcher by makeshift pallbearers in protective wear, and then toss them into a freshly dug grave. Just as individuals with Ebola are often shunned and ostracized by their communities, the initial slowness of the response by the international community in many ways left the affected countries to suffer their fates alone. In my travel to those 3 countries, despite my awareness of the suspension of flights by some air carriers, I was very shocked to find the airports completely vacant. Ebola, I said, is not just a Liberian problem, nor is it a Sierra Leonean or a Guinean problem. It is not just a West African problem. Ebola is a problem that belongs to the world because it is a disease that knows no boundaries. Ladies and gentlemen, my brothers and sisters, we've seen this already as the disease has found its way not only across land borders, but also across oceans and entire continents. People who have never so much as visited any of the affected countries in West Africa have become infected with the Ebola virus, thus exposing all those with whom they have also come into contact to the possibility of infection. It pleases me to note that despite the initial slowness of response by the international community to the Ebola epidemic, numerous nations and organizations have now come forward with offers of assistance ranging from equipment to food to medical personnel and to financial assistance. I would like, as chairman of the authority of ECOWAS heads of state, to express my sincere appreciation to all these nations and organizations for the much needed support and interventions. There's still so much more that needs to be done in order for us to help the affected nations continue their fight to contain the spread of Ebola. The purpose of this meeting, therefore, is to ensure that we make the best possible use of this assistance